Welcome back to TV5 News at 9. Today we are talking about proton therapy and lung cancer with McLaren Flint. Joining us this morning is Dr. Hesham Gayar. Thank you so much for being here, Doctor. We appreciate you.
Thank you.
Great. Okay, so this month is lung cancer awareness, and we really want to bring awareness to early detection and prevention. So tell us, who should be screened for lung cancer, Doctor?
Thank you. Lung cancer is very common, and if we catch it early, the outcome is much better. We can cure patients with more incidence. The key here is to catch it early before it becomes symptomatic and give you problems. So who's candidate for screening is your question? Those that have smoked for at least 30 pack years, that's 30 years, 1 pack per day, or 15 years, 2 packs per day, or equivalent, and are in the age of 55 to 77. So 55 years old to 77 years of age, that have history of smoking and have smoked even 1 cigarette in the past 15 years are candidates to be screened and are covered by Medicare.
Oh, wow.
Those that did not smoke in the last 15 years, we still recommend they get a yearly x-ray, but they may not be covered for the free screening by Medicare.
Oh, okay. So, Doctor, where can people go to get a lung screening in our area?
Very simple. You can call the hospitals we have at McLaren. You can just call the McLaren number and ask for the lung screening, or call our proton centers, 855-MY-PROTON, and they will direct you to the screening so you can get screened. And it's covered by all insurances, not just Medicaid. And this is mandate, is to protect patients and improve outcomes.
No, when people hear the word cancer, a lot of times they say, oh my God, it's a death sentence. This is not a death sentence anymore. There's so much going on, so much therapy. Tell us, if someone's diagnosed with lung cancer, why should they consider trying proton therapy?
Lung cancer is a difficult disease to treat when it comes in advanced stage. And at any stage, it's a serious tumor. It's not like other cancers where it could go for years. So it can cause damage, and it is serious. What's also specific about it is it's close to critical organs. The heart is there in between the 2 lungs. The esophagus, lymph nodes are laying next to the heart and next to the air pipe, next to the esophagus, and damage can be significant, and the spinal cord is right behind them. Proton therapy, radiation is one of the means of treating lung cancer, and other means are chemotherapy and surgery, and sometimes we use the 3 of them. So a plan individualized to the patient is directed. And proton therapy gives a superior radiation because it stops at the target. It doesn't go through the tissue like regular standard X-ray. So it can spare the heart, for example, from any radiation. It can spare the esophagus, the spinal cord. For cases where the cancer came back, it's a way superior treatment because it protects organ from unnecessary radiation. The advantage of proton therapy is that it lays the dose at the target. So the cancer gets the radiation, the normal tissue around 70% less radiation than conventional treatment. So that's the superiority. So it's mainly quality of life and side effects. Side effects are reduced, and quality of life is improved, and the patient live almost normal life afterwards, enjoy the lungs and heart in normal function.
Oh, that's great. Yeah, because it's that targeted therapy. Okay, tell us about this. How can someone find out and say, okay, proton therapy is for me?
Well, it is individualized, and really to answer that question, very simple. Just call and give your facts, and we will look into it. And even before we have you travel to the center, we'll study it with you and say, yes, you could benefit. Come, we'll discuss it and go through details. Or no, we advise you to stay in your area. There's no need to travel for proton therapy. You're not the best candidate for that. Lung cancer is, in particular, is individualized. And the best is to give us a call, give the fact of your disease. We'll communicate with your doctors and get a plan worked. And we can do it at convenience and function, the details and the plan for treatment per individual case and individual patients.
I love that. Dr. Gayar, to give Dr. Gayar a call. Anything else we haven't covered that you think is important if people are considering proton therapy?
I think anybody, especially young people that are looking for many years to live in their lives, it's important to protect the normal tissue. So if there is a need for radiation or someone talked to you about radiation, it's in the chest area in particular, many critical organs, the head and neck, the breast close to the heart on the left side, those organs where the cancer is close to sensitive structures. And if you're getting radiation or someone is talking about radiation, investigate proton therapy because it is a superior mode when it applies to you. And it does not apply to everyone.
Right.
For certain patients, it's way superior and it's worth it. And you need to find that out before you start therapy. So before you start treatment for cancer, investigate if proton therapy is right for me.
Well, thank you, Dr. Gayar, for giving us this information about proton therapy. We appreciate you stopping in today. Thank you.
My pleasure. Thank you for having me in your beautiful program.
Of course, you're welcome. And thank you again. For more information, just check out the hot link section of WNEM.com.